Well, thank you all for taking some time out of your day to listen to us share a little bit about how Sound ACH is responding and some of the resources we are utilizing for this coronavirus pandemic that is upon us. And I'm going to start with just a few reminders, this being a virtual meeting. Just ask that I'll try to help keep the lines quiet with muting, but if you all could also assist, and then please unmute yourself to join the conversation when we do that kind of towards the end of today. And send your questions anytime in the Zoom chat box. We will go through them kind of as we're going, and then also have plenty of time towards the end to answer any questions. And then Liz thought it'd be great to remind that it is Friday the 13th and anything can happen. So we are recording this. If something happens and we lose all of you, we will record it and it will be, we'll repost it. We've already shared the slides. And so just putting that disclaimer out there ahead of time. I'm going to go ahead and start us off with our land acknowledgement. We begin by acknowledging with humility that the land where we are today is the territory of the people of the Salish Sea. Their presence is imbued in the waterways, shorelines, valleys, and mountains of the traditional homelands of the Coast Salish people since time immemorial. Okay. So today's conversation, we're really kind of focusing on 4 areas. We're going to share a lot of kind of our experience, and quite frankly, it's really been in the last 2 weeks, the resources that we've been using, recommendations that we're referring to, and then also opening it up when we'd love to hear from the folks that are on the phone today about what they're experiencing, and start talking about potential needs that you all are feeling. So I'll go ahead and get us started. So the real about, I would say this journey has begun about 2 weeks ago, and probably for many of you even before that. We put up here kind of the reasoning why our agency has responded in the way that we have. And like many of you, following recommendations and setting guidelines and, making some tough choices often starts with, protecting our staff, our families, and our communities. And I've put up a photo of our Heather, who is pregnant right now, and she's fine if I'm sharing that. And as soon as the recommendations around high risk for pregnant women were coming out, we really were rallying around Heather and making sure that we were being safe and smart. This next photo is actually a picture of my mom and my nephew. So my mom, Francie, is halfway through her breast cancer chemotherapy. My nephew, right there, Weston, 21 months old, a bit of a terror, but also catches everything. He is a little petri dish. I share these because I think a lot of our reaction to what's happening for some of us is personal, and it really is at the heart of why a lot of the things that we are doing here is for the folks that we love. Another big area for us is showing solidarity with public health and with science. We have the luxury of being an organization that works very closely with public health, and we want to show that we're strong leaders in making these tough decisions that many workplaces have to make. And we like to, our hats are off for all of those who are working in public health right now. Having been in public health myself, this is a stressful time, and we don't want to make it any more stressful for them. And we're doing all that we can to adhere to their recommendations. And another reason, which is a core value here at Sound ACH, is around equity, and acknowledging that there are individuals at the front line and not just healthcare frontline, but frontline for those who are providing basic needs to the community, the grocery stores, the food banks, the dental clinic, places where you wouldn't normally think a frontline staff are. And we acknowledge that we are in a privileged position to have the ability to send our staff home, and acknowledge that not everyone has that privilege. And I'm going to let Liz just speak a little bit more to that because it is a core value here at North Sound.
Yeah, thank you, Nicole. I think that Nicole has really been impressing on our team to be informed as opposed to reacting to things as they come up. And one of the things about kind of the plethora of recommendations for communities right now are things like, self-isolation, distancing yourself, trying to prepare with, 2 weeks worth of medication, et cetera, at home. And I think one of the things that we've just acknowledged is that those instructions work for many of us. The notion of working remotely works for many of us, but it doesn't work for everyone. It doesn't work for people who are in fragile situations where not working today might mean that they're not able to buy the food to store up for 2 weeks. And so we know that there are people in our communities who are not able, they literally don't have the ability to follow those recommendations because either they are so critical to be at the front line or their situations are incredibly fragile. And I think we'll talk some about some examples, but if you think about folks who are reaching in to help people experiencing homelessness, who've got chronic conditions, who are camping out in different parts of our communities, those outreach workers who are working with them don't have the luxury of just working remotely to do that work. You don't get to be a dental hygienist and somebody says you should work remotely for 2 weeks. So for us, it's just recognizing that there might be some additional strategies that have to be put in place so that we actually can meet the needs of our partners as well as the people that our partners are serving.
Thanks, Liz. Okay. So how we started, and I'm not kidding when I say we really got started about 2 weeks ago. As many of us, we've been monitoring the situation and seeing how the public health recommendations have been evolving. But 2 weeks ago, we really started taking a look more seriously and figuring out how this was going to impact our partners and then also our work ourselves. We formed a small response team. I have the luxury of, I used to work with Whatcom County Health Department and have been trained in incident command system. And I'm not saying everybody needs to do a ICS structure, but it is a very helpful tool if that is something that your organization might find beneficial. And I'll talk a bit more about that in just a bit. So we formed a small team, assigned some roles. We began communicating out to partners. We were just getting started. We had finally scheduled our last site visit when we had to make a tough decision to switch over from in-person to remote, and began communicating that out to partners as soon as we made that choice. And then early this week, we developed our mitigation plan, and I will go into a bit detail about some of the resources we use and what that looks like. So decisions that we've made, and we've posted these, most of them are on our website, and as this situation evolves, we will continue to update the website, update our Facebook posts, just letting you know the difference between Monday and Friday are quite dramatic. And so we always are keeping our staff informed that this could evolve, and we need some patience with that. And we want to be able to communicate changes out to you all as quick as we can too. So our website and social media posts will probably be the best way to get that information. So right now, what we've implemented, made the decision 2 days ago that effective Monday, March 16th, all staff will be working remotely. Earlier in the week, we made the choice that all travel is canceled. There's a lot of awesome conferences that were happening in March and April, and I think we had 4 or 5 staff getting ready, myself included, to start traveling. And as the information was becoming more available and recommendations were coming out, we made the choice to start acting, be proactive, and cancel our own travel. Pretty lucky that we did that because many of these conferences have been canceled within a day's notice. And so we were able to kind of get ahead of it just a little bit, and we have found that many of the airlines have been pretty lenient on their fees at this time. We have made it quite clear with our staff that we believe in public health recommendations. We call ourselves, like the stewards of public health practices. For those that know, we stick to a stay home when you're sick policy pretty strictly around here, and we do take it seriously. I think this, what's happening right now has made us even look further into our own internal policies around that. So we have a high expectation that our staff are following recommendations for their work and their home life. There's a helpful tool. The CDC has a risk assessment for when to return to work that we will most likely be implementing once kind of our time at working remotely is up. We've made the choice that all meetings will be remote participation, canceled or rescheduled. The term non-essential has also, quite honestly, helped us really think about our partners and the impact of what their essential meetings must look like. And so we have either canceled, pushed out, trying to be as flexible. Folks have let us know, which is great. So we're just going to continue to do that through March and April. We've also put into practice, this is more of a scheduling helpful, is all future meetings, so past April, kind of into May and June, we're just going to go ahead and plug in a remote option as a default. We're still hopeful that folks will adhere to their public health recommendations, but if we're in this for a bit longer, we'd like to be a bit ahead of that and continue to work with everyone in the region. So because we also like to share kind of the practical things, what we've been updating and what we've honestly remembered, like this morning, and are adding and communicating out to our staff as we're thinking of these things is, while we've done a lot of virtual meetings, we haven't really done an official virtual meeting training. And so we've been looking into options of, how best to utilize the virtual meeting space. And we will share our findings with you all on how that goes. We found we needed to update our remote working policies, assuring the team that our health insurance is a resource. We have been getting updates, and sometimes when you're in the thick of something, you forget the things that are already helpful in place, and so we reminded ourselves of that. We've worked with individual staff to work on their work plans for the next 2 weeks. We've established a cell phone stipend for all staff for the next 2 months. And then acknowledging that as we're watching what's happening in Pierce, King, and Snohomish County with the school closures, that we have parents here and flexibility, parents and caretakers, I should say. So flexibility of schedules, and if a spouse has to work from home and the kids are out and taking care of elderly parents, we might be changing up schedules a little bit so to accommodate that our staff can take care of the things that they need to do at home. Liz, do you have anything to add to?
Nope. I think the next slide has all the things that I've been making you crazy about.
So this is the thing. So we're kind of down to we are adhering to small gathering sizes. There's only about 4 of us in the office today, and there's 4 of us running around writing and reminding each other of all of the last minute things that when you're doing this practical of like, it's time to do this, it's time to start working remotely, these are all the things we forgot. So forwarding our phones, forwarding our mail and packages, because you can't just do your mail because UPS, FedEx, you have to figure out a different way to do that. You got to empty the fridge because you just do. You also need to look for food that staff have left for you that could be a real special surprise when we return. Notifying the landlord that you're leaving, that what your plan is, notifying the cleaning crew, putting signs up on the door. And that also a reminder that information is emerging almost on a daily basis. And so these are the things at the current moment we're thinking of, but I'm sure Liz and I will think of a few more in the next 3 hours.
Well, and even just things, as Nicole mentioned, changing policies. We have an office, and you all may have offices that are similar, where people have the ability, they've got a key, they've got a key fob, they can get into the building, they can get into the office. And so we're having to remind ourselves, like, we're actually telling staff, no, even though you physically can do it, functionally, you are prohibited from coming into the office. And so we're having to just, really every day get more explicit about what our expectations are for our team to take care of themselves. And again, to the best of our ability to limit exposure and to limit being a transmitter of exposure.
Okay. So who are we listening to? There's a lot of information out there. We have started, these are kind of like our 5 common areas that we started with. The public health departments throughout the region, and I didn't even include Seattle, King County, tribal governments. And I'll just say all of these resources are on our website. Civil rights experts, there can be stigma associated with this and racism that has been documented, that has occurred. And Seattle, King County have some incredible resources about anti-stigma. We're listening to healthcare providers, listening to the scientists. We're looking at CDC. And again, all of these resources are up on our website. I wanted to call out some real specific ones in case y'all might find them useful. I mentioned before, and it's a tool to be used, but FEMA does have an incident command system training. Truly, we used it to help us figure out roles of staff, and we created an incident brief, and we probably won't take it much farther than that, but it's a tool that's been very useful for quick turnaround planning. You identify a lead, you identify a liaison to the community, a safety officer, a public information officer, and then sort of a point person for your general operating staff. And it's just been tremendously helpful for us. County health departments, community recommendations. We are physically in Whatcom County, so we have been not just daily, almost hourly, going to the county website. Earlier in the week, they increased their recommendations or changed their recommendations, and we've just been following them pretty closely. The Northwest Portland Area Indian Health Board has some incredible resources and a weekly webinar that we're having staff participate in. I had also mentioned that the tribal governments have been doing an excellent job communicating out via social media how things are going in their declarations that is occurring. The CDC's COVID-19 mitigation strategy for workplaces. It's a bit of a mouthful, but this is, I would say, our most helpful tool that showed, if you're in this scenario in your community, here's the recommendation. I'm going to mention that a really helpful resource, and this might be more relevant for our partners, and something that we'll continue to look into is Governor Inslee's office. So the health departments and Department of Health and the things I listed before are very focused on recommendations in health. Inslee's website has additional information. Earlier in the week, he had announced that there are ways for workers' compensation for those who are quarantined or impacted by what's happening. There is business assistance. It updates around school closures. There's information on how to enroll people in insurance, and there's support for veterans. Now, I mentioned that this has been an evolving process, and that we continue to watch it. And Hillary just informed me that the governor has just announced that all schools are closed until April 24th. So, talk about a changing just in the last 30 minutes. We'll share those resources out. But this website is very helpful for the most up-to-date information. There's also, we've been in contact with, there's a regional staff person for our 5-county region, Joe Timmons. He is the Northwest Regional Representative. And here's his email and his phone number. And there's the link out, and we'll put all this on our website as well. Okay. Come. What's that? That's the right one.
No, we jumped a couple of slides.
Jumped a couple of slides. Okay. Oh. Yeah, we did. Okay. There we go. Okay.
All right. So I'm going to step in, and I happen to be the one who's monitoring the green red on our microphone. So this has been pretty humorous here. So one of the things that we added, so Nicole's been talking about like how our team's been responding, but we've been having a parallel conversation about our partners. And I think starting from the premise that many of our partner organizations, while they are health systems and the counties and public health and big clinics, we have a lot of small organizations that are our partners as well. And really recognizing that many may be going through the same kind of process that we've been going through, and trying to figure out how do you translate those broad recommendations to your workplace. And so, I think that one of the things that we could do really rapidly, a year ago, we pushed out the first payments to partners around the end of May. And it was after we had done our April reporting period, after site visits were done, and we had confirmed a lot of work that was going on. Really in recognizing that these funds are at the partner's discretion to use however they need to be used best. We're actually pushing out half of the 2020 funds next week. So all partners are going to see half of what we, conceivably project you earning in 2020. You're going to see that as a direct deposit next week. And it's, it is a recognition that each of you might be having challenges of, I don't know how I'm going to pay my staff if I'm asking people to work remotely. I don't know how I'm going to have to change my sick leave or my paid time off policy in order to accommodate following all of these recommendations. It is, certainly for many of you, this is a small contribution to help support the work you do. But as we talk to our board and our finance committee, we actually feel like 100% of what the ACH is doing in terms of moving dollars is related to supporting your capacity on the ground. So for all of our partner organizations, and you'll be getting an email to describe this early next week, you're going to see half of your 2020 earnings at the beginning of the week. We also have been trying to figure out in this realm of health system capacity building, how can the ACH actually find out like what else is needed in the community? And I think that the slide that you just got a preview of, where Nicole's going to be asking you all to weigh in, we're talking about, like, are there places that you know about where they're not getting the rapid access to resources, whether from the state or the Department of Health or through health plans, et cetera, where these are critical services in the community this time of year? That, there are things that we depend on. So I think, as the governor is announcing that schools should close, at least yesterday, he was saying, but all grocery stores are open. And so how do we actually provide support for people who have school-age kids? The schools are closed. What does that mean for people who don't have school-age kids, who've had their kids in daycare? What happens when daycare centers close? That there just may be things that you hear about that we would like to have the door open, so that there are things that the ACH should be thinking about in terms of supporting not only our contracted partners, but the services that you see surrounding the work that you do. We have our finance committee support to try and have a fund that's available to help with that. So really kind of those two big things that we're pushing out payments next week, but we would like for you to help us know where some of those areas are. When we think about, some of the stigma and how things sometimes get described in the media, that we just keep recognizing there are communities that are shrinking back because of fear of intimidation and recrimination because of this virus. And so, where are the community centers serving immigrant communities? Where are the community centers that are serving communities of color that are not yet contracted partners to the ACH, but you may know about them because you're the community action agency working in a specific county? You know the tendrils of, like, who's actually struggling to follow the directions and meet the needs in the community. So we're trying to be an ally and an asset and connect some of those pieces.
Okay, so this is the participation part. Let's start with the first question. If you could go into the group chat out to everyone, what challenges is your organization encountering with the COVID-19?
Do you want people to, like, unmute themselves if they want to jump in?
Yeah, hold on. I got to unmute everybody. Let's see.
Okay, so we've now made it so that you can mute and unmute yourself. So if somebody wants to jump in, who can think of things that we should be thinking about or needs that you have within your own organization, whoever wants to jump in first. I can hear somebody, but I can't totally hear what. This is like Weston.
It is. It's just like,
so maybe I'll just give a couple of ideas that we've been, I don't know that we have answers to them. But, so we have, for example, we use Zoom and Uber Conference. We've been talking about, we've been talking about, knowing that not everybody has, audio, video, conference lines, can you reach out to us and we can just share, we can schedule things for you and your team using some of the technology that we've got access to.
Okay.
Would it be helpful, to have, and I'm going to just be picking on Nicole, Would it be helpful to have somebody like Nicole, who can share some information with your teams? Again, knowing that not everybody's got an epidemiologist on staff, to try and translate all of the information that is coming and to try and figure out, what are the specific strategies that you might be able to take on. I think one of the other things, and it's interesting with the resources Nicole pointed out, some of the best resources are actually also coming from partners. And, it is realizing that this pandemic, also has the ability to trigger trauma. And so, how it is that we're working with people in our community, what are some of the things that we need to be aware of? And you all may be the best resource in trying to describe to other partners how to address something that is very traumatizing to people and is kind of triggering behaviors and triggering reactions to things.
So Liz, we have a couple comments, and there's a common theme here. What frontline staff is concerned about is having adequate personal protection equipment moving forward: Sani-cloths, cavi wipes, gloves, masks, etc. Dean from Northwest Youth Services says our front-facing programs for youth, pad shelter, and ground floor drop-in center may need help with supplies, thermometers, masks, sanitizers, dispensers that allows us to keep those facilities open. We may also need financial help bringing on added staff at the pad to help to staff separate areas where we could isolate infected youth. And Dean, I'm going to unmute you. Let's see.
Okay.
Oh, you did it yourself. Perfect. Have you been in contact with public health, or have they reached out? That we also, our new community impact director, Alicia Benish, had previously been homeless mobile unit homeless director down in Seattle, King County. And she had just been mentioning the connections that her program and public health were doing. Has there been any outreach or conversations that you've heard so far?
Yes, we've reached out to public health, and I've been to, a couple of meetings, and because I wear a department hat, I've been able to have some conversations. On the supplies end, I think, they're running low themselves. And, on the financial help side, really that was more of a contracting conversation with the contract manager with the health department, who said that they didn't think there was flexibility in their funding stream to add funding for staffing, for extra staffing to staff isolation areas.
Okay.
We've got capacity, we've got spaces in the pad that we haven't been able to house youth in because they're sort of out of line of sight as rooms from other areas. But if we needed to use them for isolation, we could, if in fact we had added staff.
Okay. And so I may turn to, I think it was Ted who had the other question about supplies and such. One of the questions that we've actually had is, when there's a shortage of supplies, is number one, we probably can't order things because I don't know that we would order the things that one would feel is appropriate for a work site. So is that a financial issue? Is it a supply chain issue? Because we certainly have heard this, from, emergency responders all the way through care settings. Ted, can you unmute yourself and maybe just talk also a little bit about that?
Not Ted, it's Tammy.
Okay, Tammy, sorry.
Northwest in Ferndale. And it's just a supply chain issue,
Yeah.
We're being very judicious about what we're using here and when we're using it. But, there just isn't that availability, and vendors are scrambling to provide things, but essentially everything's on back order. So, moving forward, especially the clinical staff, they're concerned. And how are we going to, work with these patients that are potentially contagious? And yeah.
And so coupling your comment with Dean's comment. So how could the ACH be helpful in that scenario?
I don't know if you have, yeah, I mean, you're not there. I don't know if there's anything you can do. It's just kind of bringing some awareness to,
Okay.
hearing some angst from staff.
Yeah.
Right now we're okay, and we also have dental. So those positions are, wiping down frequently with Cabby Wipes 1, or we're using Santa cloths. And, but that too. Behavioral health needs to do that too. So it's just, people are just concerned when they see, people buying all these general supplies out in the community, but also the vendors kicking back with, hey, we're out. We don't know when we're going to get more. So I was just bringing awareness to some of
Okay. So if there's anything we can do in terms of, because again, I'm going to say, I haven't seen any great messaging about, like, how do you have people not use panic as the driver for emptying shelves? And, which I think what we've been realizing is just, it's a sign of the fact that people are afraid. But if we can understand that might be impacting the care provider's ability to actually have access to the resources they need, if you come across some messaging that we could be including, happy to include that. That would be really great. And then, Dean, I think if you've got, some ideas around, that staffing and or supply thing, would love to hear about it.
Okay. And I do have an idea. I mean, we could give you a number on the staffing thing, and on the supply thing, one of our staff happens to have a spouse who works at Whidbey Island Naval Air Station, and they were speculating whether the military might have, for example, supplies of those standing sanitizer dispensers that people could, they can share them out, from the military stockpile with organizations who need to have, people doing that when they come in their space or whatever, or other supplies. I mean, if you guys have any relationship with the military in the region or not, but maybe that's a possibility.
Okay. Cool. Okay. That's really helpful.
And we got another comment that Bellingham schools just confirmed they're closed until April 24th.
Mount Vernon also, the Skagit County.
All right.
I think the governor just announced a statewide closure.
Yeah, so that might all be in response to the governor's announcement. Yep.
Yeah.
Very, very unique time we are in right now. It is green and red and green and red.
Okay, we're green again. Here we go.
Is there anybody on the call who has suggestions for folks we should reach out to that you haven't seen, like at an ACH gathering yet? Like other community coalitions, I mean, I think of like, is there a coalition that's working with at-risk youth? Are there some community groups that you're aware of that we maybe should be talking to as well? And you can either say it out loud or you can send it to us in the chat, either way. But, I think that's the other thing we're looking for is just, are there other groups that might, I don't want to say get lost, but are probably not going to be as prominent in being able to follow these CDC, World Health Organization, County Health Department kind of blanket sets of recommendations that we should be trying to support. Yeah, why don't you go ahead?
Yeah, so Rose from Ideal Options said, we do medication-assisted treatment for substance use disorder. I just want to mention that we're operating as normal if you have anyone who is in recovery with Suboxone or Vivitrol.
Awesome. Thank you, Rose.
Thanks, Rose. Ben Young is on. Hi, Ben. Snohomish County Foundation and United Way has said that they have emergency funds for small businesses and nonprofits on an expedited basis. Wonderful. That's a great resource.
Yeah, and we have gotten questions from a couple of foundations asking us as well, like who are those groups that they should be reaching out to and paying attention to. So, you know, I do think the funder community is loosening some funds and trying to move them out. And, you know, I think we're depending on you to give us some ideas about who they should be getting in touch with. Because what I know that at least one, they're trying to avoid, we've got funds available, you need to now submit an application so we can review applications. We know of at least one large funder who actually is just looking for people that they can call and direct some funds to. And I have said to them, wow, I will ask that on this Friday phone call. So hoping if you know of some community coalitions or community groups who don't typically get grant kind of funding, if you could send that our way, that would be really helpful.
And Liz, I'm assuming also we'll keep this conversation open.
Yes.
And as we, many of our partners are very busy and you know, trying to get in touch with the community action agencies that we're currently working with, and ask some very similar questions and figure out kind of who are the community outreach programs that are present in our region. So I expect that we'll be developing some kind of rapid assessment tools that help us look at those, you know, primarily around individuals impacted by homelessness and then also childcare. Now, I mean, it became extremely important in the last 45 minutes around childcare. So yeah, I expect that we'll be asking for more information as this kind of continues.
Well, and again, I haven't heard anybody say something like all childcare centers are closed.
Right.
But and that's, you know, it's really that we're hearing about the schools, and I'm as concerned about the folks we're not hearing about who are also impacted.
Yep.
You know, and I think, you know, Nicole's already gotten to hear this, but you know, I had a dentist appointment this week, and I came back from my dentist appointment going, oh my God, I'm so worried about dentists. And so reached out to the Arcora Foundation, you know, formerly the Delta Dental, asking them how are dentists getting their information about response and preparedness, and got pointed to the Washington Dental Association, which has a dearth of resources, but was reminded most dental offices, small employers, independent from any other institution. And so when I think of, you know, even you on the phone, you're like our care delivery system, but you are also primarily small employers. So, you know, can we help with how you're thinking about your own internal plans, as well as how you serve the people that you're serving? You know, we're going to try and keep something on our website, and trust me, we are not, absolutely not trying to pretend that we're the expert or we're replacing public health, because we're going to keep pointing you to your county public health departments and the State Department of Health and all of those other resources. But can we be a bridge for you when you think about yourself, you know, as an employer with teams of people that you're also responsible for, that there just are things that we might start saying, maybe you should send this to your primary care provider, to your dentist, to your acupuncturist, to your chiropractor, because they are not in the loop about this information. And, you know, it's just, we can assume everybody's hearing what we're hearing, but the reality is not everyone is hearing what we're hearing. And we still have, you know, somewhat of a community mindset that, oh, this does not impact me because I'm still feeling fine. And, this is unprecedented, at least in my lifetime, to have a governor say we're closing all of the schools in the state for the next 4 or 5 weeks. There is something very, very different happening here, and how we can put materials together in enough of a plain speak language that become tools that you can use, that you can share. I think that that's one of the other places where we're thinking we might be able to be helpful.
So we have about 8 minutes left. I'll go ahead and open it up just to, let's see here, just any additional questions, comments that we didn't go over. As Liz mentioned, we're learning through this, and also learning what's helpful and what's not helpful. If you find any of the things that we presented kind of about like our process, we're happy to share our documents, our links, whatever might be helpful. We've gone through it now in just 2 weeks of this extremely steep learning curve. So happy to share anything. You can email us at team@northsoundach. But we have about five minutes or so if anyone has some additional questions or comments.
Hillary just shared, we've actually added a spot on our website for the COVID-19 resources. So, she's going to be trying to keep that updated as things change and evolve. If there aren't any questions, I just want to close with a couple of things. One is that we are really taking the approach that if something is not essential, that we need to be asking of partners and community right now, we shouldn't be doing it. That we should allow, the best way to kind of interrupt an outbreak is to halt its transmission. So, we're really trying to see what we can do to support that. At the same time, we are so incredibly grateful for those of you that while I get to tell a team of people go and work remotely for 2 weeks, it's recognizing how many people are actually leaning into this crisis and this outbreak because they are essential to us taking care of the people that we care about. So, we just are in this very unique space, and I am just so much in gratitude to all of you, working with the populations that you serve. We're trying to see what we can do to help get non-essential things out of the way so that you can do what you do best. And, we try to circumvent this in the best way that we can. So just know that our team is a resource for you. If there are things that we can do for you and for your teams, to let us know that. If there are things around our resources that you can use, please let us know that, because there's not a reason that you need to necessarily recreate all of that, and we're happy to share anything that we've got available to share with all of you. So, I don't know, Nicole, if you have any other closing, because otherwise we can.
Because we're kind of in uncharted territory, and we are a community of caretakers and huggers and want to be with each other. Our team is also really doing what we can to stay connected with one another, with making sure we're looking at each other and in Zoom lines and using our cameras so that we can see each other. We don't know how this isolation is going to impact a lot of people, and we need to take care of ourselves. And that's first and foremost the most important. And we're going to find some different ways to kind of do this connection with one another. Just acknowledging that this is going to be tough for some of us, and that we're going to have to check in on each other and take care of each other just a little differently. So I'll just end with that one.